Body Shop Physical Therapy. I'm going to talk about Bell's palsy. Bell's palsy is the paralysis of the facial nerve that leads to weakness on one side of the face. This neuromuscular skeletal condition is near and dear to my heart as I have a family member that has a surgically induced Bell's palsy, and when I was in PT school, the director of the program had Bell palsy. So I stayed attuned to listening to the neuromuscular skeletal tracts that is related to the facial nerve and trying to understand what would be some of the best approaches to being able to treat or help manage this condition. And it can wear on people's emotions. So when you lose the function of one side of your face, it makes it difficult to talk, to drink. It is then can be disappointing, to say the least, to lose your smile, especially when you are having a wonderful, vibrant smile and then it's lost. It is a grieving process if that doesn't return. And sometimes the return comes back and sometimes it does not. So what has been thought is that Bell's palsy can come from either viral or bacterial infection. Folks that have had Lyme's disease can develop Bell's palsy. Sometimes it comes on, it's idiopathic, which we don't know why it comes on, and there is thought that there's inflammation on that seventh cranial nerve. So there's two things that I find are helpful for Bell's palsy. One is, first you want to know the anatomy to help you be able to determine, well, what can you do for this? So if there's inflammation on the nerve that's causing compression, leading to the paralysis of that muscle, then you want to reduce that inflammation, and that can be done through drugs, but also using modalities. As a physical therapist, we use cold, so using a cold pack. The stylomastoid foramen is a hole, so that nerve comes out of the stylomastoid foramen. The seventh cranial nerve is the facial nerve, and that's just behind the ear. So what I recommend is using a cold pack and placing it behind the ear from 10 to 20 minutes, and do this on a daily basis frequently if the Bell's palsy is in the acute phase and it's just come on and you're trying to reduce the inflammation on that seventh cranial nerve. Something that I have found super helpful to know and try. So using a cold pack, placing it right behind the ear to reduce the inflammation on that seventh cranial nerve. The other way that you can get around the facial nerve is using the corticobulbar tracts. So what corticobulbars are, so those have a motor component to the facial muscles, and it is going to be from the central nervous system. So we've got the peripheral nervous system and the central nervous system. The cranial nerves are considered part of the peripheral nervous system, and that is where it exits the brain, and that is where the nerve is being affected in the periphery. So it's a lower motor neuron problem. So if it's a lower motor neuron problem, we still have the upper motor neurons intact, and that just means that the brain and the spinal cord have nerves that supply the motor component, and you can use those pathways. So the corticobulbars for the facial motor are going to come from the brain. So they go from the motor part of the cerebral cortex into the brainstem and then supply the facial muscles. And how to activate corticobulbars, it's involuntary. So voluntary control means that you can control the movement. So you can whistle, you can smile, you can frown. That is going to be under your control. But when it comes from the central nervous system, the brain or the spinal cord, and it's automatic, it is not in your control. And one of the ways that you can activate the involuntary control of your facial muscles is laughing. So one of the things that I recommend is to watch comedy and laugh as much as possible. That will help continue to keep the muscles stimulated. And if you see or observe someone with Bell's palsy and watch as they laugh, it is intriguing to see that the muscles that are not alive off of voluntary control become alive when there is an automatic um, connection or activation of the facial muscles. So if you are struggling with and have Bell palsy, that has immediately come on, and you're trying to reduce inflammation on that seventh cranial nerve, cold pack behind the ear and watch comedy and laugh as much as possible. Laughter is truly good medicine. Hope you have a blessed day, and thank you.